So knees, the stability of the knee is very important here, and because of the knee needs to be stable on the side-to-side motion, this hip has to work very hard. So you end up having what we call the runner's knees, basically the ITB or the iliotibial band that crosses on the side of the knee. It makes the friction on this bone and becomes very tender. So that's a common thing. The second most common thing is pain in the kneecap, and it's mostly the patellar tendon that gets inflamed. Okay, knee injuries for running is very hard to rehabilitate, because one of the things that you can do that is no impact to help you maintain condition for running is biking. Well, if your knee hurts, then biking doesn't become an option there. You've got to be able to rest the knee to allow it to heal, and that's when we start using the pool to get some cardio so you don't decondition, so while the knee heals. Okay, so that is knees. So let's talk about ankles. The ankle is the same thing. Even if you do, the difference between mid-foot strike and heel strike has to do with how the forces impact the rest of the system. Okay, on the beginning, most of us are going to do heel strike because it feels easy. Okay, it takes more effort to do mid-foot strike, and it takes more strength. So when you start getting to the more advanced levels of jogging and running, if you start doing more mid-foot strike, or you start, hitting this part of the foot first, remember the calf is going to have to work very, very hard. And if you start feeling your calf a little tight, you might want to progress there a little bit slower, because the last thing you need is a new injury, just because you're going to do a better form. Okay? In the long run, it's going to help. The difference there is this: when you heel strike, the forces goes from the heel to the knee to the hip directly. Okay, so you have three joints working to shock absorb your body going on that impact. Now when you do mid-foot strike, now you have all those little joints in the foot also shock absorbing, so the forces up the chain are much less. However, it requires more strength on both in your feet and your calves to be able to do that. So little by little you can progress to that. Okay? Now, if you start having any problems with your feet when you start doing your strike and loading, you're going to start developing strain on the ligaments of the foot. So the most injured part of the ankle, unfortunately, is the outside of the ankle, and then down on the bottom of the foot to the plantar fascia. Plantar fasciitis is very, very common, unfortunately, and it is an overuse injury. The plantar fascia is a very thick tissue, and the repair is not as good just because there is not enough blood flow there. Okay, and so you have to respect, because there is no way to strengthen the plantar fascia. Okay, so you got to maintain a healthy fascia by allowing it to rest as it needs to rest, and you stretch if it is too tight, and correct your gait, you correct your foot mechanics if that is the issue. So if your foot goes out too much, you got to be able to correct that, and unfortunately there is not a shoe that corrects supination, by the way. Okay, so you have to know somebody that can really fabricate that support for you. But most of us go into pronation when the foot runs inward or the arch collapses down. And that being more common, you do have shoes that can give you support for that. Okay, so make sure that if you do have an issue with your gait or an issue with your feet, that you get the proper shoe for it. And then if you need extra support, you get the right support to do that.